Oh, joining us now, Christina Dent, founder and president of End It for Good. So, Christina, I'm going to ask you again because you never know whenever you come on who's listening, who's not. Tell us exactly what the organization does, End It for Good.
We are a Mississippi-based nonprofit, 501c3, and we invite people to support approaches to drugs that prioritize life and the opportunity to thrive. So we're looking at drug policy, everything from production, distribution, consumption, addiction, all of that, and how can we reduce harm to people who are struggling with that, to their families, to the broader community. So whether or not you're using drugs or if you've never used drugs, we want a world where there's less harm related to drugs in it, and that's what our whole mission is.
Gotcha. So we've got the session coming up, and I know you advocate for such policy with our lawmakers. And we've got the session less than 2 weeks away from today. Exactly, right? I did that right? I think so. Yeah, January the 3rd. They'll be convening. What would you like to accomplish? And before, it's kind of a backdrop to that. You provided me with a couple of cut sheets here that explain what is drug checking. So, and it's very informative with respect to especially fentanyl and the ravaging that's done on our country, for sure. Now, like the number one killer of young people, right, in our country, if I'm not mistaken.
Really,
I'm not sure
bad.
What the age range is,
Yep.
but and a lot of folks do it. They ingest this substance unsuspecting.
Right. They're buying drugs off the internet, or they got it from a friend who got it from someone they know that's selling some pills, and half the time they think it's a legal pill because you can make pills with a pill press that look exactly like their legal counterparts, and so they don't have any idea that it's contaminated, and it's actually far more potent than they think it is.
Okay, so there's some drug checking technologies that have come onto the scene, and the cut sheets you handed me explain those. Tell us about that.
Yeah, so probably the most popular one of those is called fentanyl testing strips. So these are legal or decriminalized in 31 states, and they're basically a little strip of paper that you can take a little bit of the powder of whatever drug you're about to use, you dissolve it in water, you dip the strip into it, and within 2 minutes it will give you 1 line if there's fentanyl in that substance, 2 lines if there's not. So it is just a quick, easy, simple way for someone who's about to use a drug to know, is there fentanyl in this? And research has just shown that people who use fentanyl testing strips, 45% of them use smaller amounts of the drug, and 42% of them use slower to avoid overdose. And so it helps people to make less risky choices related to their drug use if they have access to these. And they're less than $1 a strip. So it's cheap. It's an easy way to do that. But right now, Mississippi's drug paraphernalia law is very broad, and any kind of testing devices would fall under that. So it's too gray for people really to be able to use them safely here without being potentially caught and arrested for having drug paraphernalia, when really a fentanyl testing strip is just a way to figure out, are you about to use a drug that's contaminated with fentanyl?
So, okay, so it would be categorized as drug paraphernalia and might have charges?
It is not. There's not a carve out for something like this where we can say, hey, this is not. You're not going to be arrested just because you are trying to stay alive.
So are these available over the counter in a drugstore? How does it work?
They can be. So in other states, sometimes they're actually the governmental agencies that are over their addiction crisis or overdose crisis provide those for people. They use some of their grant funding money to use them. Sometimes they're given out by like community mental health centers. Sometimes they're provided by nonprofits that are working on ways to reduce harm to people, help people stay alive. You think about even in Mississippi, a prime place for something like this would be Moore's Bike Shop in Hattiesburg. So James Moore lost his son to an overdose, including fentanyl, a couple of years ago. He's owned a bike shop in Hattiesburg for decades, and he decided that he wanted to begin giving out Narcan, the opioid overdose reversal medication. So he was able to get that through the Department of Mental Health, and to be able to provide that for anyone that came into his store. They could say, hey, can I have some Narcan? He could train them on it and be able to dispense that to them. So for people who maybe are using drugs that they're buying illegally, or maybe for parents who don't really want anyone else to know their child is struggling, it was a very someone like him is a great connection point. They might not go into a medical clinic, or they might not go to a government agency and say, hey, can I access Narcan or fentanyl testing strips or something like that? But they will go to someone in the community that they trust. And so they're great kind of connection points for people like him. He's been doing Narcan distribution for years. And so we want that to be able to continue. There's been some changes to that. But those kinds of things in other states especially, there's lots of different ways that these can get out into the community in a way that they're actually getting to the people who need to use them.
So is it as simple as we just need to essentially amend statute such that these testing strips are not characterized, or categorized, I should say, not characterized, categorized as paraphernalia under the law?
Yes. And so there's a couple of different ways to do that. So some states have just said fentanyl testing strips are legal now. Pennsylvania actually, I think, did something really forward thinking. They just changed their law, and they said not only are fentanyl testing strips going to be legal, but we're going to allow for any testing technology for any drug, not just fentanyl. You can get testing technologies for methamphetamines, cocaine, things like that. And also any new technologies that come out, not just strips. So there's a company out of Florida that has developed testing wipes. So instead of having to have a powdered substance that you dissolve in water, you use a wipe. You literally wipe the pill, or you wipe the surface. So think about law enforcement, first responders who are getting somewhere and they don't know, what is this powder I am seeing? They can use a wipe. They can wipe it. It changes color immediately if it is positive for whatever substance that wipe is designed to tell you about.
Reacts to it.
So those aren't commercially available yet. They've just been developed. They're being tested by the law enforcement agencies that are actually in the community where the company that produces them is. But it's amazing. You can go online and watch a video of it. It's incredible to watch this little wipe. They swipe it across. It turns pink immediately. Cocaine positive.
I'll be darned.
And so it would be great for us to think about kind of those broader things, not just fentanyl testing strips, but if there's a way for something like a wipe to be accessible, for us not to have to go back and change the law again to say, here's the new technology, but really just to say, we want law enforcement, first responders, people who are using substances, college students who are taking pills that they shouldn't be taking, but many of them are taking anyway. How can we make sure these people have the ability to know if they're using a contaminated substance that is potentially going to kill them, and be able to save lives that way? So it seems like a slam dunk for us. There's a lot of support for fentanyl testing strips among law enforcement also here in Mississippi. We actually learned about the testing wipes from the Oxford police chief, who had heard about it because it's an emerging technology and it's not available yet. He had heard about it, and he said, these would be even better because you don't have to crush the substance. We don't want people crushing pills. And yet there are a lot of people who are already using powdered substances. They need to have access to those testing strips, but we really want them to have access beyond that, to be able to make healthier choices and choices where they're going to stay alive and we're going to have fewer funerals.
What else are you going to be talking to legislators about in the coming session?
That's going to be our big focus right now. We really feel like making that shift towards how can we save lives? How can we shift away from just trying to punish our way out of this crisis? I was talking to a doctor last week, and he made a great point as we were talking about the difference between sort of continuing to try to crack down our way out of the fentanyl crisis and tougher sentences. And there's, people have been talking about, well, let's just do life in prison, or let's just do the death penalty for distributing fentanyl. And he said, the thing is that's the risk of death is already baked into any kind of activity in the underground market. There's no amount of cracking down or longer sentences that is beyond the risk people are already taking to sell drugs when you've got cartels and gangs and all of that. As part of that, we can't crack down our way out of that. They're already taking massive amounts of risk.
It's true.
But we can try to say, okay, what's driving them to do that? It's the financial incentives behind drugs being available on the underground market, and how can we bring those back into a way that's not going to kill people.
I can't see why this is not something that we can't get done, so I'll certainly be tracking that. I'm assuming that folks in the legislature you've talked to, Nick Bain, et cetera, they're on board with this?
There's a lot of support for it.
Okay, good. We'll be tracking it. Appreciate you coming on, Christina. You and yours have a very happy, healthy, safe, Merry Christmas, Happy Holiday.
You too.
Safe, prosperous New Year.
Thank you.